Hello everyone, my name is Brian Bennett. I'll be speaking with you briefly today and providing you an update on forensic application of thermal imaging. If you should need to reach me, my email address is there at the bottom. It's imbkb1@gmail.com, and my telephone number is 803-896-7534. What I'm going to speak with you about has worldwide implications. If we proceed correctly with the correct goals in mind, what we could accomplish in the near future could literally change how the world responds to documenting assault injuries, particularly non-fatal strangulation assaults. So enhancing evidence-based prosecutions of strangulation assaults through thermal imaging. That's what I'm talking about. Is it possible? I absolutely believe it's possible. Many of you doctors, nurse practitioners, other practitioners in thermography know very, very well what the capabilities are of thermal imaging with respect to your specific disciplines. Many of you have seen me before at prior conferences, also perhaps a presentation I did for the Canadian Association of Clinical Thermographers, where I spoke about a similar topic using thermal imaging for criminal forensics, and that's kind of where I come from in my background as a law enforcement officer. Certainly in the clinical area, many of y'all have been using these for 5, 10, 15, even 20 years, some of you, and you know what it can do in the clinical area. But what I've always been kind of passionate about, not kind of, but very passionate about, is bringing this into the world of criminal forensics to add another layer to substantiate and indicate non-fatal strangulation assaults have occurred, and getting patients correct medical interventions and getting offender accountability through the courts and prosecution. But I absolutely believe it's possible with the technology that we have currently and as we move into the future. So my brief professional background, again, some of you have some familiarity with me, but I've got 24 years of law enforcement. I'm court qualified in law enforcement training. I'm trying to get qualified in some non-fatal strangulation cases. Interestingly enough, there is every time I get subpoenaed, there's a plea bargain and they plead guilty. I don't know if that has anything to do with me as a expert in non-fatal strangulation, but it's what I get called to do sometimes. I do specialize in strangulation assaults, vulnerable adult and elder abuse. I've served as a co-chairman on various task forces doing legislative work, education, and outreach. And not only do I instruct law enforcement, but as you can see, many disciplines within the clinical medical area I provide some training to as well as far as non-fatal strangulation. So that's kind of me in a nutshell. A couple of published articles that I would ask you to look into is one article published in September of 2016, officer.com, called Beneath the Surface. And this was kind of one of my initial articles into the idea of using thermal imaging in assault crimes. We have lots of ways to document assault injuries, but what do we do when people claim they've been assaulted, but the injuries are internal or they're not externally seen? What can we do to enhance those claims? And that's where, again, I first brought forth this idea. Another one is called Subtle Signs of a Killer, published in July of 2018. Also, you can find on officer.com, and that was just talking about the subtle signs and symptoms of non-fatal strangulation, the lethality to the victims and to law enforcement, and as it relates to a lot of our mass shooters. A lot of our mass shooters actually have a history of strangling their intimate partners, but also bringing in, again, that idea of thermal imaging. So I'd ask you to check those out for a lot more in-depth into the non-fatal strangulation assaults. So a little bit of background on strangulation, non-fatal strangulation in thermography is one of the things I've pointed out over the years is that strangulation injuries have lethal consequences. Sometimes those consequences are immediate in that they cause death. Sometimes death is delayed. The medical complications, which there are over 25 documented medical complications that are associated with non-fatal strangulation, could in fact cause death within hours weeks, or even months later. And even if it doesn't cause death, there are significant long-term injuries internal to the body that can last the remainder of someone's life. Anoxic brain injury, damage to the vascular structure of the neck, and also the trachea as well. Most of our injuries are internal and therefore not visible externally. It's interesting that external injuries, the ones that we see with strangulation, are actually more rare, and the internal, more subtle injuries are actually more frequent. And so if we can enhance our imaging to pick up on those internal injuries, then we are doing a greater service to our strangulation victims and getting them the medical intervention that they need. Cases can be really, really hard to prosecute because everybody expects to see these external injuries and these external signs that a strangulation occurred, again, when in fact these more subtle but more frequent signs are often missed and they're not documented to bring into the courtroom to substantiate the claims and other evidence that a non-fatal strangulation incident occurred. So, but even though I'm real big on offender accountability, the number one priority is medical intervention. Only 3% of strangulation victims get medically seen. And of that 3%, even less get appropriate screening and evaluations for those strangulation injuries. So this is a serious life and death issue. So what is this hypothesis that I'm kind of presenting? Thermal imaging can validate claims or known indicators of strangulation. I believe the technology exists and that we have enough professionals here in the United States and worldwide that could serve as experts and image interpreters if we use thermal imaging at the right time, in the right way, and in the right conditions. And so that's what I'm trying to build here, and I absolutely think it's possible. So validation is absolutely required. So in the criminal courts and in many scientific evaluations is something called the Daubert and Frye test. This Frye case from 1923, the Supreme Court actually states that an expert opinion is admissible if the scientific technique on which the opinion is based is generally accepted as reliable in the relevant scientific community. So that's what we need to build here. We know that thermal imaging is used across veterinary science, clinical science. We know that over the past decade or so, with a lot of the work that y'all have done, the establishing of the validation of thermal imaging is growing stronger and stronger and stronger to a point of being generally accepted. Where this kind of falters, though, is in the criminal forensics area, is where we need to start building this generally accepted, reliable, and relevant scientific use of technology in a scientific way to validate what we a lot of times know is going on and we want to prove is going on. Additional to that is this Daubert case of the U.S. Supreme Court in 1993. And the court was talking about a rule of evidence, and rules of evidence are very, very kind of absolutes in criminal trials. And as you see here, it talks about the rules of evidence 702, relevance and reliability. Those are two key words I want you to remember: relevance and reliability. And going beyond the general acceptance, this is another level, a stricter level. Whether the expert's technique or theory can be tested and assessed for reliability, whether the technique or theory has been subject to peer review and publication, the known or potential rate of error, the existence and maintenance of standards and controls, and whether the technique or theory has been generally accepted in the scientific community. So these are levels of evaluation that many of you are already familiar with, but this applies not just in your clinical field, but also in this criminal justice forensics field. And this is where we, as a community of thermographers or people that have an interest in thermography, hopefully, with your help, we can take this to a level of evaluation for peer review and testing and being able to show that standards exist to standardize this and make it acceptable. So some goals and challenges as we move forward. I'll be completely honest with you to say that the work in this area has been extraordinarily slow. Many of y'all have seen me since 2016, and progress has been excruciatingly slow, primarily because I'm the only person that I know of that's researching this and trying to put this forward. But I would also like to give credit to Dr. Schwartz for encouraging me to press forward in spite of some shortcomings with personnel and money and supply and cooperation. And so much thanks to him, and much thanks to you as a community who've reached out and expressed continued interest in this. So what are the goals and challenges to us moving forward? Well, if we don't do anything, we certainly aren't going to move forward. So we're going to do some more today. First of all is establishing a working group or a task force. In consultation with Dr. Schwartz and a number of other professionals, we have decided it best that we seek a multidisciplinary approach to this, looking at it from all aspects, not just from the law enforcement field, not just from the clinical field, but also from the educator field, the prosecutor field, judicial field, and certainly again in the medical field, getting nurses and doctors on board who all can see kind of their piece of the puzzle and how all this fits together. Because if we take this just into the criminal justice field and we don't have input from our medical professionals that we're trying to get our victim to, and we don't have input from our prosecutors who are going to have to present these Dalbert Fry validations, we're going to come up a little bit short. So we also need to identify some collaborative partners in order to move forward. We need to identify some funding and supply sources for equipment. And a real big issue here is collecting images. Let's talk about each one individually. We have a number of persons already identified. I have some individuals who are PhD educators who are very involved in the academic world in the criminal justice field at various colleges who've expressed an interest in serving on this task force. I have a number of nurses who are forensic nurse examiners or sexual assault nurse examiners with many years of experience who thankfully understand in great detail the dangers of non-fatal strangulation, and who have also agreed to be members of this task force or working group. I have a number of individuals in the legal area, what I mean by legal is in the judicial and prosecutor area, who've expressed an interest as well, and a number of doctors. And so we're bringing a lot of people to the table. However, not all of them are available at the same time. As you might imagine, we all have some very busy schedules that sometimes prevent us from meeting. We haven't had a meeting as of yet, but ideally we want to try to meet at least quarterly, even if it's virtually, to discuss and have meetings and input to develop plans for progression. We want to keep things moving forward. As it relates to collaborative partnerships, things that we've discussed just kind of in general is identifying some research universities. We know there's lots of universities around that do all kinds of technical research in physics and in science and in imaging, but also our medical universities. So we want to reach out to some research universities who may have an interest in partnering with us to utilize thermal cameras to evaluate patients and evaluate victims for non-fatal strangulations and other assaults. As far as the medical area, some of our collaborative partners that we would like to involve are individuals who work in the emergency room, the doctors themselves, the triage nurses, and of course the forensic nurses. The biggest challenge, however, is the law enforcement prosecution partners. The reason being, and the reason I think there's been some resistance, is law enforcement and prosecutors are very apprehensive about using technology that is not already tested. They don't want to be the guinea pigs, if you will, to purchasing equipment, which in their eyes may or may not work, and then also just the manpower of collecting those images and when to do it. And so that is what I've seen has been the biggest challenge on my side, is until we validate the technology, until we validate it in the courts to some degree, law enforcement is going to be very resistive to using something that's unproven. Do I think it's impossible? No. I think with pressing forward with these goals, we can get there. It's just going to take some time. But certainly we want that buy-in from our law enforcement and prosecutor community. Funding and supply equipment. We know that some of our collaborative partners that we might seek out could have their own entity funding. Some research universities have a large supply of donor money that can go to perhaps supplying the thermal imaging in the rooms needed to do this. I would give you as a quick example, here in South Carolina we have Columbia International University that is a Christian college. However, they have just started a nursing program that was funded by millions and millions and millions of dollars of privately funded and donated money. And I toured their facility the other day, and they have one of the most technologically advanced nursing programs that I have ever seen, with fully functional animatronic, not to say dolls, but basically animatronic people that can replicate just about any medical emergency you can think of. Strokes, all kinds of convulsions. They can actually take blood and blood pressure, and actually some of these can actually have babies. So we know that some of these research universities and stuff may have funds available to purchase the thermal imaging equipment and or equip the rooms necessary for proper exams and imaging. We also know that there's grants out there that are available. The VAWA, Violence Against Women Act, federal grants often supply money to victim services and law enforcement agencies. The issue with that is finding a grant administrator. Again, with me being just an individual person with a full-time teaching schedule, I don't have the time to manage a grant with the 15 other things I have going on. However, our collaborative partners may have grants available themselves that they've applied for to do this. Here in South Carolina, just recently, a group of forensic nurse examiners in the upstate just secured over $1 million in a grant to expand their forensic nursing program in the upstate, and it's entirely possible that some of those funds could go to purchasing the thermal imaging equipment that would be needed. Obviously, would never turn down donations. I'm not really sure how that works and what the ethics are of that, but certainly people, if they know our desires and they know our needs, might on their own feel prompted to provide donations that would, again, provide the necessary equipment to put in the hands of our collaborative partners. And then there's just the simple logistics. How do we get the equipment in the right people's hands, and how do we get the data back to us where we need it? And so logistical planning is really, really important. Again, this is a progression of how do we move forward, and everything is kind of in small steps. Lastly is image collection. I really appreciated the presentation that is going to be before this one related to normal versus abnormal images. We know that the American Academy of Thermology has a large database of all kinds of medical conditions which show normal images versus abnormal images. That is what we need specific to non-fatal strangulation assaults or assaults in general. We need to build a database of images. Again, normal versus abnormal. And so when we get into our identifying our collaborative partners, this is one thing we would need to inform them of, is we need not just the abnormal images, but things that relate to normal images with images and photographs that the equipment can take. And we also need quantity and quality. The more that we have, the better. The more substantial we can say that this technology actually works and does what we think it is going to do. And also quality. We don't really need bad quality images. That's not going to show what we need. The sensitivity of the thermal imaging cameras, and again, if I'm using bad terminology to call them cameras, please forgive me. That's just kind of what I call the common man's language. But the quality of the images needs to be one that has really good detail and very, very small thermal detection. In other words, those variations between temperatures need to be very, very small to pick up on the very subtle things that could come along with non-fatal strangulation. So again, by me saying cameras, please forgive me if I'm using the wrong terminology. But in conclusion, again, I think if we do this right, if we keep this moving forward, I think that we really can change people's lives. Again, I want to get our strangulation victims into the hospitals, into the triage, so that we can save their life. But at the same time, I want to take the things that they say and they tell us about what happened to them, things that we find on the scene, things that the clinicians at the hospital see with their own eyes and see through their test, and have that added to these images that we take that can all, again, point us to these non-fatal strangulation incidents and the injuries that are going on, to hold these offenders accountable. All too often, they choose this non-fatal strangulation as a means to control, because it leaves very few or little external injuries, and so they use it over and over and over again, and each time putting that individual's life at risk. And so I just want to thank you for your time. If you have any questions, again, my email is imbkb1@gmail.com, and my telephone number is 803-896-7534. My name is Brian Bennett, and it was a pleasure to be with you.